Hello, this is Anthony Chadwick from the Webinar Vet, welcoming you to another episode of VETchat. Really pleased today to have my good friend Russell Chandler on the line. Russell will be well known to many people, but you may have heard a podcast that we did last year sometime. Is in Singapore at the moment, working at a practice there, and I was very fortunate to be able to go and visit him on the way back from Australia, where I'd been giving a talk on sustainability to some of the big groups over there. And he very kindly, and I didn't know he was up to this, he's a man of many talents. He's now a published author. He very kindly gave me a signed copy of his book, Regenerative Medicine in Small Animal Musculoskeletal Conditions. Must have been a huge amount of work for you to put this together, Russell. I've been having a look through it, and it's a really great text. Obviously, loads of references in. That's been a work, hasn't it? You've spent a bit of time doing that.
It's been a labor of love.
Yeah, no, I bet. But it is such an interesting area. I remember talking about it probably for the first time with John Innes around lipoma cells and things. And that was probably maybe pre-pandemic. And I was looking through some of the references, and they're all, a lot of them are sort of 2020s and plus, guess 2022. It really is a kind of brand new area of medicine for us as vets, isn't it? Obviously, copying some of what's been done before. And I saw your lovely tribute to Dr. Kaplan, who looks like he was the kind of starter of it all in the human field, sadly passed away last year. Tell us a little bit about what made you get interested and do the book in the first place.
Yeah, okay. So I can tell you a bit about my journey. So
Yeah.
I'm very interested in lots of different areas of veterinary medicine and surgery. And my primary training is in orthopedic surgery. But I've never had a linear kind of career. I've always had a bit of a wiggly career.
Yeah.
So I've tended to get interested in things, go off in one direction, learn about those, and then come back to the center and then go off in a different direction, learn some more about a different area, and then bring that back and combine all of those sort of skills and different pieces of knowledge and stack them up so that hopefully what we get at the end is a kind of a marriage of all of those different disciplines. So I'm quite active within the osteoarthritis community, and I am a director of a non-profit called Veterinary Osteoarthritis Alliance. And we do a lot with the education side and the promotion of best practice in osteoarthritis. So on the osteoarthritis side, most of the treatments that we have for osteoarthritis, they tend to be dealing with the pain, restoring the function of the musculoskeletal system. But there isn't much really that we can do to reverse the disease or to modify the disease. So there's a genuine unmet need. Hence, that's where regenerative medicine comes in. And when I first learned about platelet-rich plasma and mesenchymal stromal cells, and these are the two main branches of regenerative medicine within our veterinary field, I was fascinated by that, and I wanted to get my hands on some and start using it. So, like a lot of people, I kind of went into this without any knowledge. So there was a huge gap in my understanding of what regenerative medicine was, what it can do, what it can't do, and how we should go about using it. So then what I was able to do, and I was very fortunate that I found a master's degree at Bristol University. So I was able to study there, and it was during the pandemic, so it was remote. So that was suitable as well because I could still work and then also study stem cells. And that gave me a 3 year sort of foundation
Mm.
on the science of the subject. Not content with that, I felt that, well, if I'm going to do 3 years of study to bring myself up to standard with the knowledge side, how am I going to use that, for the wider good? So that was the genesis really of the idea of well, if I'm going to spend time studying this and have access to all the resources, then why don't I put it in a book?
What was the master's, topic that you were going in? What
The
was,
master's was stem cells and regeneration.
and presumably mostly medics on that course.
Well, so scientists really, it's for scientists. So it was a postgraduate
Yeah,
degree for people who'd done cell biology and knew a bit about stem cells. And basically they were people who are going to be the ones who create new treatments in labs.
yeah,
So taking it from what we say is bench to bedside. So I saw my role really in that as a clinician working with those scientists as trying to bridge the knowledge because the laboratory scientists, they're brilliant and they have their knowledge, and the clinicians on the other side, they're also brilliant but in a different way, and there doesn't seem to be much that is joining the two or allowing them to communicate. So the idea behind the book was, well, why don't we produce something that can allow scientists and clinicians to have an overlap in their knowledge and to be able to communicate so that it benefits the patient? So I've had scientists read the book and they've said, oh, that really showed me a lot about what the clinical aspects of what we're doing can achieve. And likewise, I've had clinicians read the book and they say, well, that scientific grounding, because I've tried to make it palatable, was really useful. So that kind of was the reason behind it. I gave myself a year to do the writing. And the reason I gave myself a year was because I had access to all the resources from the university. And then
yeah.
I knew that at the end of that year, I wasn't going to have that. So it was a bit intense, really. But I always like to have a deadline. So having a deadline suits the way that I work. So that's how it all came to be.
I had the same thing with my cert in veterinary dermatology. I gave myself 2 years. I was early on in my career. I was about 2 or 3 years of vet. And I think the first 2 years you kind of move around because of your mistakes. You treat everything with steroids, and surprise, surprise, they don't get better or they keep on coming back. And I went to a course, got hooked on it fairly early in my career. So by year five, I'd got my certificates, and I felt that that helped to turn me from an empiricist into a scientist, really. And I know you've done obviously the Royal College certificates in small animal orthopedics. How much of a jump was it from small animal orthopedics, again with the Royal College standard, which was obviously extremely high, and then to now do a master's? What was that like, for you as a kind of lifelong? I know you're a lifelong learner, but how did you find doing the master's, and how did that compare with the Royal College certificate you did earlier on?
Yeah, I should mention that it's not my first master's. I've also done a master's in orthopedic engineering. So that's what I meant when I said that my path has not been straightforward and I
Mm,
have deviated. So I can talk about both really. The thing about being a clinician and being a vet is that it's very different from what the engineers do, and it's very different from what the scientists do.
mm,
So you kind of have to learn a new language.
yeah,
I think doing a certificate in orthopedics is a reasonable progression from what you're actually doing in the surgery room and as a veterinary surgeon. Whereas I wouldn't say it's so much more difficult or a higher level. It is a slightly higher level doing a master's. But when I did the engineering, then I had to learn a different language in order to be able to communicate with the engineers and in order to be able to do the mathematics and all of that. So that just took me off in a different direction and used a different part of my brain, which I felt was helpful. And then doing the stem cells, well, the same applies, but in a different way. And the thing about the cell biology that has been discovered or created within the last 20 years is that when I was an undergraduate, none of that existed.
no,
So the way that we thought of cells, the way that we thought of DNA, way that we thought of immunology was so different and basic compared to what we think of now, is
yeah,
that I had to learn really from the beginning
Yeah.
the whole of the cell biology side. My daughter used to laugh at me because she'd done a degree in biochemistry and pharmacology, and she couldn't believe the gaps in my knowledge, the lack of knowledge that I had about the mechanics of what goes on at the subcellular level.
Yeah, yeah, yeah.
So it was quite hilarious because I had to borrow some of her textbooks, and then when she sees me actually writing a textbook, she thinks, the transformation going from somebody who knew nothing about cell biology to actually being an author. I mean, she finds that completely, completely unfathomable.
Well, I think it's the old what was the thing that Mark Twain said? He said, when I was 14, my father was an idiot, and by the time I was 18, I was amazed how much I'd been able to teach him.
Exactly. Exactly. So, yeah. So, I mean, so from the science side, honestly, for me, it was a challenge.
Hmm.
But because I had a goal in mind that I wanted to learn why I was doing regenerative medicine, how I can do it better, and what on earth is going on. Because up until that time, I was injecting PRP, I was
Yeah,
injecting stem cells,
yeah.
and I was seeing really good results.
But you had no
But I
idea why.
thought, I have no idea how or what kind of cells I was injecting, how they were meant to work, and how we could refine it. Because in those days, it was just a case of, well, we've got PRP, platelet-rich plasma. We can get that, make it autologously from the animal. We can re-inject it back into a joint, and it seems to help.
Hmm. And that's empirical medicine, isn't it?
Yeah, and likewise with the stem cell side, we were using stem cell. I was using stem cells as a very kind of blunt instrument.
Hmm.
Now I'm at a stage where I feel that my colleagues and myself hopefully will be able to very much refine what we're doing and target our treatments much better.
Hmm. And do you think that the first masters helped you to make the second masters a bit easier because you understood the journey that you would go on?
I think so. I
Yeah.
think so. Yeah, definitely. Not many people do what I've done, and in such disparate fields as well. But I think it kind of opened up new possibilities to me.
I think it's really interesting because, and there is no planning in this, but I was earlier on today speaking to Drew Tootle, who's obviously very much, runs his practice in Melton Mowbray, the MSK clinic. And, talking about all of those sort of medicines. I have to say, I was slightly disparaging of surgeons because, a surgeon does the job, he does the piece of surgery, and then to some degree, he can lose or she can lose a little bit of interest in the case. I know I'm being generalistic and I apologize for that before I start getting rotten fruit thrown at me at veterinary conferences. But I think what this does and what he was suggesting as well is it's very much, the surgery is the first piece of the puzzle. And actually, all of this things that go alongside, like physio, like stem cells, they can all help to accelerate healing from surgery or indeed make surgery unnecessary.
Yes, absolutely. And I think Drew is one of a new breed of vets who crosses those disciplines
Yeah,
and will do rehab and will work with physios.
yeah,
Yeah, surgeons have got a bit of a reputation of being a bit sort of single track or single-minded. And to be a good surgeon, you really do have to concentrate on what you're doing
yeah.
and hone your skills.
And be a
But the
perfectionist.
downside might be that that kind of narrows the horizon.
Yeah,
Myself, I can do surgery. I like doing surgery, but I also like looking broader at
yeah,
what other things that we can do and how we can get other disciplines involved. Osteoarthritis, especially, is very much a multidisciplinary
yeah.
pursuit where you need the rehabbers, you need the physios, you need all sorts of things other than surgery. And that it's that collaboration that I really enjoy at this stage of my career. It's it really it makes it so much more interesting when every day is a learning day when you're dealing with people who've got different knowledge from you, different skills, and it just makes it way, way more effective for the patient.
Hmm. No, that's great. obviously we've talked about the different type of stem cells, and obviously there's platelet-rich or treatments, sorry, regenerative medicine treatments. There's platelet-rich plasma, there's mesenchymal stem cells, there's stromal vascular fraction. But obviously the two that you mainly deal with in your regenerative medicine is platelet-rich plasma and stem cells. Perhaps give me a bit of an idea of how they are similar and how they're different, and where you might use one as opposed to another one.
Dealing with PRP first. So almost always PRP is autologous. That means
Yeah,
that the patient and the donor are the same
yeah,
animal. So we draw blood and then we're interested in the platelets. So when I was an undergraduate, platelets were for blood clotting, and that's all
yes,
we kind of knew. That is true. But what's also true is that they are very, very regenerative because of the granules that they have inside with lots and lots of different healing molecules. So what we do when we take our autologous PRP is that we want to concentrate the platelet to about 4 to 7 times the original blood's concentration. And then we resuspend those platelets within some of the plasma, and then that becomes our orthobiologic. So we refer to biological products that we inject into the orthopedic system or the musculoskeletal system as orthobiologics. So platelet-rich plasma is a very simple orthobiologic that anybody can use within practice because all you really need is to be able to draw blood, process in a centrifuge, and then be able to inject in the target organ, which is most likely going to be a joint. So if you can do intra-articular injections and you have the basic equipment for making the PRP, then you can use PRP. So PRP is a very good means by which the healing process can be stimulated. It's probably better in more acute cases, so it can be used in muscle injuries, tendon injuries, sprains, that kind of thing. But it can also be used in osteoarthritis. And the other thing that you can do is you can combine it with your mesenchymal stem cells, your MSCs, because the PRP has fibrin in there, or fibrinogen, which can form fibrin when it's in the tissue, and that forms a scaffold. And the scaffold is useful for the MSCs, for the mesenchymal stem cells to attach to. So moving to the mesenchymal stem cells, the stem cells that we're talking about are MSCs or mesenchymal stem cells, and they are within most tissues. So the most convenient places to get them from are bone marrow, placenta, umbilical cord, and fat tissue. And fat tissue has become the most readily accessible place. So we used to think that fat tissue is just fat tissue with adipocytes, but there's a lot of blood vessels within the adipocytes. And the cells that are attached to the blood vessels, to the capillaries, these pericytes so-called, are the precursors of the MSCs. So if you take a piece of fat from a dog or a cat, you can guarantee that there's going to be a lot of blood vessels in there, and attached to those blood vessels are going to be your MSCs. So when you take that then to the lab, the MSCs have got this special property whereby in the lab, they like to attach to surfaces. So if you have a plastic vessel, the MSCs will attach to the plastic vessel, okay, and you can wash away the other cells. So one of the characteristic features of MSCs is that they have to attach to plasticware within the lab. Then you can expand the cells, which means that they will undergo a process of division and expansion in number. And then you can passage them through different generations. And normally we'll passage them up to about 4 or 5 generations, by which time you'll have millions of these MSCs, which under the microscope, they just look like fibroblasts. And these MSCs are the cells that are effectively the living medicine that we can then inject. Most of the time it's autologous, which means we're taking a fat biopsy from the dog or cat, usually it's dogs. the falciform fat seems to be the best place to get your sample from. You send that to the lab, it goes through this processing and manufacture, and then the manufactured cells will normally be ready in about 3 or 4 weeks, where they come back to you from the lab in a little vial, sterile on the inside, so that you can then thaw them, and when they're defrosted, you can inject them into the target organ, which is usually a joint. So that's how it goes. That's the autologous side.
Hmm.
MSCs can also be allogeneic, which means it's from one animal to another animal of the same species. So from a dog to another dog or a horse to another horse. We don't have that in small animals as a licensed product yet in the UK, but we do have a xenogeneic product. So a xenogeneic MSC means that the cells come from a different species. So the licensed xenogeneic product that we have is actually from horse umbilical cord, from the Wharton's jelly of a horse umbilical cord, where the cells are taken from there. And umbilical cord is very rich in MSCs, and these MSCs are young and healthy MSCs, and they are passaged and expanded in the lab, and then they come to us in a vial where we can inject them into a joint of a dog.
Where are the labs? Are these normal labs, or is this a particular lab that does
Right.
this?
So you need a specialized stem cell lab. Okay. We have a couple in the UK. The one that I'm talking about with the equine umbilical cord xenogeneic MSCs, they come from Spain.
Right.
So they've got a facility down there where they've got a manufacturing hub, and they can produce these xenogeneic MSCs. And this product is licensed throughout the European Union. So it's got a UK license and an EU license.
Nice. Fantastic. But obviously, if if we're using, platelet-rich plasma, presumably that falls outside, and obviously talking from a UK perspective, outside the remit of VDS anyway, because you're just injecting basically animal with some of its own cells and platelets and so on.
Yeah. So legally, platelet-rich plasma is more of a process or a procedure than it is a drug.
Yeah.
Whereas if you've got so any autologous product, as long as it's minimally manipulated, then legally it's not a drug. Whereas if you've got a xenogeneic product,
Yes.
like the dog stem that we referred to, that has to go through a different set of regulations in order to get licensed and to be used with the European Medicines Directorate and the VMD. Exactly. So that's the legal side. So I think anybody embarking on regenerative medicine needs to know, obviously, a little bit about the legal side, and they need to know what's available. And if they want to get started, then PRP is a good way of getting started, because you just
Yeah.
basically need to get a centrifuge and have the training, usually
Yeah.
from the company that sells you the centrifuge. So the book, if I can just mention the book is a very good guide. I hope the aim was it's a very good guide
Mm.
so that anybody can pick that up. And if they read it and understand what's in there, and it's not too scientific, it's meant to be practical. It's a practical guide. They can use that to get started in regenerative medicine. And the advantage of that is that it opens up a whole new realm of treatment. As I've
Yes.
said, with musculoskeletal conditions, a lot of them, like OA, osteoarthritis,
Yes.
is a degenerative thing. It's incurable, it's painful, and there's not much that can make a difference. But if you can use stem cells, then you can get a long-lasting effect and can really positively impact the animal's life.
Yeah. And I think, the book obviously says it's a practical guide for veterinary professionals. Obviously, at the moment, a very specialist field, but speaking to Drew before and speaking to yourself, it feels like it should be something that a GP could do once they understand the basics. And I think the basics are explained really well.
Yeah.
The background, because I think, as you say, you can inject platelet-rich plasma into a joint and it does better, and that's great. But having an understanding of why it works will obviously give you more success at treatment, won't it?
Precisely. Yeah, so I agree with that, Anthony. Um, and it's something that several of us have been teaching for a while. Myself, Drew Tootle, Andrew Armitage up in Scotland. Between us, a lot of us have been sort of promoting regenerative medicine to vets and, suggesting that it shouldn't really be a specialist thing.
Yeah.
Obviously, we do it and we do it a lot, and we know a bit about musculoskeletal disease, but there shouldn't be a barrier to learning how to do this because the techniques that we use actually aren't that difficult. There's a bit of laboratory processing. Most of that is outsourced. There is a little bit of surgery if you're collecting autologous fat samples, but not much. And the main thing is confidence in injecting joints. And
Mm.
most small animal vets, that's where they lack the confidence,
Yeah.
but it's not as difficult as it purports to be. Equine vets, on the other hand, they don't worry about injecting joints. They do that all day, every day. Whereas
They're a bit bigger
small
than
animal
ours, aren't
vets,
they?
yeah, the small animal vets are a bit more cautious. But
Yeah.
there are courses that they can go on, and the VOA runs those from time to time. So I would encourage people to take a good look at regenerative medicine and see how that might fit in to their clinic, because I'm sure that they've got lots of animals with osteoarthritis, and I'm sure that many of those animals could really benefit from some regenerative medicine.
And obviously, reading sort of around the subject and more into human medicine now, we're seeing some fascinating possibilities of regenerative medicine into spinal cases to help people to walk and to regain their mobility again. Also, I have glaucoma, and there is some work suggesting that you can inject at the back of the eye the optic disc to regenerate the optic disc. So I think it's a really fascinating area of medicine that is much bigger than just musculoskeletal, isn't it?
Yeah, I agree totally. And one of the challenges I had, one of the difficulties that I had was keeping my focus narrow enough within regenerative medicine, because I could have gone much wider and spent 5 years writing a book on all aspects of regenerative medicine in dogs and cats. One of the problems with the field is, from an author's point of view, is that it's moving so fast.
Yeah,
So I finished writing the book a year and a half ago. And since that time, there have been a lot more advances. So you can't put everything into a book of this type. And by the time it's published, like all textbooks, parts of it are going to be out of date. You
yeah,
cannot future-proof it. So
yeah,
that's why I kept the focus narrow and wrote about what I knew, which was
yeah,
musculoskeletal disease, and not try to make it too wide or too deep or too inaccessible. I've read a lot of books that are intended for vets, and there's just too much
yeah.
science in there, too many acronyms, and you get to the bottom of the first page and you think, oh, I can't wade through the rest of this. So that's why I've kept the jargon to a minimum and tried to put a glossary in there, make sure that everybody's on the same page as to what we're talking about, and make it practical, because that's the most important thing. Because if it's not practical, then nobody's going to use it and
Yeah.
there's no point.
And obviously, for those people not on the vodcast but listening in, via Apple or Spotify, I've got the book up at the moment. It's Regenerative Medicine in Small Animal Musculoskeletal Conditions, a practical guide for veterinary professionals, and very much looking through it. It's less than 200 pages. It's really, really well set out and really clear and very explains things really well. Because of course, a lot of this is new language, and as you say, acronyms, that regenerative medicine people use isn't necessarily ones that an ordinary vet will be familiar with. So I think it's really good the way that you've done
Precisely.
it. So it's published by 5M. From a sustainability perspective, I love it because it's printed on FSC paper and it's World Land Trust as well, which means it's carbon balanced print. So you're pleasing me from every angle here, Russell. It's a great
Yeah.
book, but also a sustainable book as well.
There's also a digital version for those who don't want to even get it printed. You can get the digital version
Yeah.
from 5M.
What's the easiest way of getting hold of this? Is this now in bookshops and
It's in 5M. It's on Amazon.
yeah,
Yeah. As long as you know the title, you can go to my LinkedIn and
yeah,
there's a link from my LinkedIn.
brilliant.
So yeah, it's there. Hit me up and I'll show you how to do that.
Yeah, and do link in with Russell. He's a great chap to be connected with, so I would encourage you to do that. You know, I love these podcasts. It's a free chat with an expert. I learn a bit. Great way to do your CPD, but hopefully it's also been useful to those people who are listening as well. So, Russell, really appreciate your time, and yeah, I think I'd really recommend the book as something that we as vets, GP vets, it's the people that I'm most appealing to with Webinar Vet. Most of us are GPs, and it's always good to stretch yourself and try something new. And I think regenerative medicine is a really interesting area to get involved with. So I'd heartily recommend the book. Look at Russell's LinkedIn page or go to 5M Books and you should be able to find it there. Russell, thank you so much for coming on. I always enjoy speaking to you. It was great to have a couple of days with you last month, showing me around Singapore, fascinating place. And
Absolutely. It was
yeah,
my
really
pleasure.
appreciate it.
Thank you, Anthony, and thank you to the Webinar Vet for having me on VetChat.
Oh, thank you so much, Russell. And thanks everyone for listening. Hopefully, see you on a podcast or a webinar very soon. Take care. Have a great rest of the day. Bye bye.